is Christine. I am your moderator for today's event. So again, as a gentle reminder, we have to follow these guidelines. Okay, first, you have to open your video camera. May we please request you to open all your cameras? Hi, Dr. Nina. Hi, hello. Welcome to Reviderm Academy. Hi, Miss Nadine Guerrero, welcome. Hello, yeah, so thank you for opening your camera. Okay, then appreciate if you can put your proper name, so this will be the reference for the issuance of the certificates. Okay, and please mute all your audios to avoid any interruptions. And if you have any questions, you can raise your hand later, or you can message us in a chat box and we will answer all your queries later. Okay, so once again, I would like to welcome you all to our Reviderm Academy. So this is the first run for this Reviderm Academy topic. So we are doing this on a monthly basis. Like we do runs topic 2 times in a month, but every month we will feature a different topics. So yeah, thank you. So thank you for joining us today. So let me welcome our presenter for today, Dr. Emad Tanash, Brand Manager of Spec Bright Group LLC. Welcome, Doctor.
Thank you so much, Christine, and thank you for the brief introduction. Just to save your time, guys, and to value it, we will briefly give you the scientific introduction for this meeting. Then later on, we will be moving to the part of hands-on work. Last month, we have submitted our first sessions of Reviderm Academy, and it was about acne. And this month, we are starting another topic, which is about rosacea. Why did we choose the acne and rosacea as our first 2 topics? Because it's commonly known in this part of the world because of the harsh environment, the sun, and the humidity, and even the lifestyle that we are living. It promotes a lot these 2 types of indications. We spoke about acne last time. For whoever did not attend with us the last month, probably you can see it in our YouTube channel. This month we will be talking about rosacea, and in order to treat or deal with a skin indication, you need to know the characteristics, how to diagnose it. You need to know what are the causes and the triggers and the risk factors that may lead to such skin condition. I'm sure that you are all expert in your place and you know it, but we will just have to review it. Then when we talk scientifically about this indication, we will all the time relate to the basic science of the indication itself. Okay, allow me to start the presentation. Christine, can you please stop sharing your screen so I can share mine?
Okay, Doc.
Thank you so much. So the characteristics of rosacea, as you all know, start first with facial redness and then develop into small blood vessels, the spider veins that comes on the cheeks and in the nose. It can be accompanied actually with irritation and dryness and swelling of the eyes and eyelid. It can lead to pumps later on, which we call it the acne-like rosacea. And these pumps can actually develop into an acne and contain pus. And on a later stage, we get the enlarged nose, particularly for the elderly. Whenever we grow old and we get the skin condition neglected, we will have what is called the rhinophyma. And it's more common in men more than women. The causes, you know, until now, there are different theories about the causes of rosacea, but it is not like fix it. It's not telling that we have this cause. If we know the cause, then we can treat the cause and we can stop the condition. But actually, it comes to multiple factors. Like most of the diseases, it can be related to history of the family, like genetic. It can be related to an environmental condition, and it can be related to a lifestyle. But as a common thing, that the cause of rosacea is basically because of the bloodstream increase at the skin site. So if you look at the hot drinks as triggers, spicy food as trigger, alcohol intake, all increases the blood flow and extremely make the blood to run to the skin. And it is irritated already skin, and it is a thinner skin, so it may lead to rosacea. Wind, sun especially in our part of the world here, we have the sun almost about 10 months of the year. Extreme heat, we have it is about 6 months of the year with extreme heat, and even harsh exercises. The more that you make harsh exercise, the blood flow, the flush, the rash that you get on the skin allows the development of rosacea. Emotional stress. Emotional stress can be actually a cause for any disease that we have. We know that our body is a cylinder of chemicals. So these chemicals, as the neurotransmitters or the chemical transmitters, control our body behavior physiologically and even psychologically. Any disturbance to this balance and the hormonal balance causes a disease or a condition. One of it is actually rosacea. Some drugs intake, particularly the blood pressure medication, because it actually dilates the vessels to allow the blood to flow easily without pressure on the vascular walls. So that allows more of a blood reaching to the skin. And additionally, some of the wrong cosmetic products that the client is using, which is hyperallergenic, it causes allergy at the site of the skin. So it triggers the rosacea. So now we know the characteristics, how to diagnose it, and now we know what are the triggers. Lastly, we will come to the risk factors. If you have one or two of these risk factors, you are most likely to develop. If you have the whole risk factors, so you will actually develop rosacea and you have to deal with it immediately. Unfortunately, the first risk factor is the gender. It's more likely to happen to females more than males. And then the second is the thin skin condition. The more you have a thin skin, the more you are liable to have some damage and extreme heat damage, and then the formation of rosacea. Age, when you grow older, again, the skin is getting thinner, and then when you reach 30, you have to think, oh, if I have a thin skin and I'm a female and I have a lighter color skin and my skin is damaged, then I have to be careful about my rosacea. Smoking or free radicals in general, because the free radicals are a source of an inflammatory process inside the skin or inside our body in general. So the more we are exposed to the smokes, the more we are exposed to free radicals, the more liable that we will develop rosacea. And then finally, the genetic case. So the whole risk factors, if you have it together, so you are most likely to develop rosacea. So now you know the risk factors. Now you know how to diagnose the skin and to say that this is the rosacea condition. And then finally, you will look at the risk factors, the triggers, and try to eliminate it. What are the stages of rosacea? Whenever you have a rosacea case, you want to classify it as per stage, so you know exactly which condition that you are dealing with. Is it just the first stage, the preliminary stage, which is having a periodic erythema? I mean, the erythema comes and goes. It doesn't stay for long. It comes probably when you are exposed to one of the triggers, but it goes away. But then you have to know that this is the first stage, and then you have to put the proper regimen to control this condition. Or you go to the stage 1, which is the erythema started to be persistent, and you develop also spider veins, telangiectasia. Additionally, you may add up what we said about as acne-like rosacea. You will have papules, pustules, you have an edematic skin, and then it can actually be infected and have pus inside. And then we can reach to the stage 3, which we want to avoid. That happens to the elderly people, which is hyperplasia, and excessive proliferation of the cells at this area, and give you a hyperplasia of the connective tissues and the sebaceous glands. So you want to go at every stage with different regimen, depends on the severity of the stage that you are treating. So what makes Reviderm probably is a product of a choice when it comes to rosacea is some of the patented actives that it belongs to Reviderm itself. You cannot find it in any other products in the market. One of it, and the basic element that we use to treat rosacea, is the VEGF, the vascular endothelial growth factor inhibitor. Actually, what has happened, we have growth factors on our skin. One of it produces a new small vessels, new micro vessels. That increases the blood flow to the skin and actually accordingly increases the inflammatory process with rosacea. So if you have an active that works on this growth factor and stop it, then you are eliminating the production of new vessels on the site of the action. And then accordingly, you reduce the blood flow and reduce the inflammatory process that happened there. And you reduce the redness as well. The VEGF active inhibitor actives is alone can actually control the first stage of rosacea. Like we see here in one of clinical studies, the usage of the vascular endothelial growth factor inhibitor alone as a home care product leads to a reduction on the skin, redness, erythema, and a case of cuprose and rosacea in general. The use of only one product twice a day on the face for about 2 months. Here's this case study starting from this particular day 0, and then after 1 month, and then the second month, that was the improvement, okay? Sometimes we do have a condition that is called the fight back mechanism from the body. That means when we start to use the active at the very beginning, the case is worsening for about 2 or 3 days, and then the skin starts to react positively to the actives later on. Indeed, when we have this condition, we shouldn't stop using the actives on the skin. We should actually increase more so we can control the body reaction to the actives that we are using. So sometimes we consider the worsening of the case at the very first week as a good sign that the body indeed is starting to behave positively to the treatment that we are using. So the very first actives that we are using is the vascular endothelial growth factor stoppage. We reduced redness, we reduced the formation of new vessels at the site of rosacea, and we need to use the inflammatory process. What is the second active ingredient? It's called wild indigo. Wild indigo, actually, it is very commonly used in the alternative medicine and the Ayurvedic treatment. Why? Because it works on the nerve ending, the nerve synapse. Okay, what is the nerve synapse? If some of you are not like deeply into the medical point of view, will understand that there is a nerve ending and there is some sort of chemotransmitters that have to be transferred, but the mechanism might be a little bit confusing. What is happening is that at the nerve ending that comes from the brain and from the central nervous system, the pre-synapse produces some chemotransmitters. The chemotransmitters goes and to be accepted on the receptors in the post-synapse, and accordingly the action is happening as per the body behavior. And this is happening with the inflammatory process. When you have a damaged skin, when you have a damaged cells, the nervous system started to react and send some signals on the pre-synapse to cause the histamine release. And actually it's a protective measure from the body, but it causes an inflammatory process at that site as well. What's happening is the wild indigo goes and the post-synapse and actually blocks receptors that stops the action of the chemotransmitters. It means that it inhibits the inflammatory process at the site of action immediately. So it's not only relieving the condition, but it's inhibiting it at the very first beginning of its happening. That's why it's, again, one of the most efficient actives used in the with rosacea and cuprose. It's said to be also that it's a funny thing, but it's said to be that it can actually help in releasing the endorphins, the happiness hormone. We don't have a clinical trial to say that using the cream will make you happy, but it is actually in the alternative medicine and the Ayurveda, they are using it to relieve the pain, to relieve the itching and redness and inflammatory process, and it can make the client a little bit happy. What are the third active that is actually particular for Reviderm is OPC pycnogenol, oligomer proanthocyanidine pycnogenol. That is only for the Reviderm company. It's one of the potent antioxidants. As we have seen, rosacea can happen from the trigger of the oxidative stress of free radicals. So if you are using a very potent antioxidant, so you can actually eliminate the trigger factor of the free radicals. And being also an anti-inflammatory, then it can add up to the treatment of rosacea. OPC pycnogenol indeed is not only for rosacea, because it's antioxidant. You can use it for rosacea, you can use it for aging, and you can use it for acne as well. You see, the benefits of the OPC pycnogenol is a lot, starting from the protection of the blood vessels and capillaries, starting from the protection against the oxidative stress and inflammatory process. So it can be an anti-aging, it can be for rosacea here, it can actually be a good treatment for eczema and regulation for the inflammation, for the skin condition as irritation, and for the rosacea. And it can be treatment for an acne when it's reduced the inflammatory process and increase the blood flow. We have said in the previous slide that it actually can be used in the non-inflammatory phase because of the increase of the blood flow. If you have it in the skin and the rosacea, it's very inflamed skin, you probably need to use the OPC at a minimal dose, not at a higher dose, so you don't increase the blood flow at that stage of. But you still have the wild indigo, you still have the vascular endothelial growth factor inhibitor. Okay, so the more common actives that you can use in the when it comes to treatment of cuprose is VEGF inhibitor, that's patented to Reviderm. OPC pycnogenol, that's another potent antioxidant patent for Reviderm. Wild indigo, wild use in Ayurveda, but we use it in the skilled care. And you can add actually the microsilver. When you have the acne like rosacea, then you need an antibacterial effect in addition to the anti-inflammatory. So you can add up the microsilver. What is the regimen that you can use in treatment of the rosacea and cuprose? Cuprose therapy serum 1, cuprose therapy serum 2, and the fluids and the cream. You will find that the main active ingredient, as we said, the vascular endothelial growth factor inhibitor. You can add the wild indigo and OPC pycnogenol to this treatment and the other regimen, more of potent actives. But you will realize here that, and with rosacea particularly, we are using the concept of the less is more. I mean, because this skin is already inflamed, irritated, this skin already damaged and thinner skin. So we use the least of the actives that are actually directed to this indication to let the skin repair and prepare itself for more resilience and tolerance to the condition. Other additional products that you can use, gentle and gentle. We use a gentle cleanser and a gentle toner. Okay, we count on the moringa seed extract and the licorice root as two main active ingredients. One is a cleanser, moisturizer, and anti-inflammatory, and the other one calming and soothing. We can still add 2 masks to this, the cuprose therapy mask, which is the main mask for the treatment, that it has gained the vascular endothelial growth factor inhibitor, and we had the peptide. Peptide here is actually having a quick calming and reducing of the redness in addition to the licorice root extract. And then you can alternatively add the activating mask in the stage where you have edema and swelling of the skin, in addition to strengthening the blood vessels and draining the extended veins, so removing the extra veins from there. Okay, if we will look at another clinical study that talks about only using the regimen for the home care product, 6 weeks treatment, you'll find that we use the serum 1, the serum 2, we use the cream twice a day, and we use the mask 3 times per week, and this is the result of control that you can get with the home care products only. The cabin product or the professional product is exactly the same and with the exact same actives that we spoke about, but we tend to add ultrasound to the treatment because ultrasound also helps in repair and in the cell regeneration of this damaged and inflamed skin to give us healthy layers and arrangement of a healthy layers of the skin, again, to increase the tolerability. In case that you know, we do have one product that's called CellJet that is a pure ultrasound skin care to be accompanied to our professional treatment. So we because in Reviderm system, we say that it's not only a product that to be used, but it's also a mechanical involvement that you can add up. Microdermabrasion, that you can add it for the skin rejuvenation and acne, and ultrasound that you can add for the irritated and inflamed skin, and the microneedler that you can have it when you want actually the actives to penetrate deeper in the skin. So you open up channels in the skin and add a kit that is particularly either for the acne or for the rejuvenation or for lifting of the skin. The action of the needler, as you all know, is that when you do channels on the skin, you actually irritate the skin that make it or like influence the repair mechanism of the skin to start rebuilds the damaged area with new types of skin. But in the rosacea, we just tend to add the ultrasound as a major protocol with the professional treatment. Okay, so thank you so much for being a beautifully attentive audience. Now it's coming to, as usual, the fun part, which is the demo that we are providing. Today we are having our setup from Amouage Polyclinic, that's a clinic in GBR. We have Reviderm and we have been loyal clients since like 2-3 years. So I will leave the stage right now for Charmin. She will be making the demo. If you have any questions regarding this presentation, please, you can just send it to me on my WhatsApp as usual, and then we will be collecting these questions and replying it immediately. Thank you so much again for being with us. Now the stage goes to Charmin.
The session for this month, or the second month of our Reviderm Academy sessions. And the topic is about copper rose. So I am here in Amouage Polyclinic to show to you the steps involved in a copper rose treatment. So we have here our model bill. So definitely I will be doing a less is more strategy. In other words, I have to do a treatment which will be less in steps, but giving more benefits to a sensitive skin, okay? So if the client is wearing makeup, we will then cleanse the eye area using the 2-clean eye. Okay, but she doesn't have makeup today, so I'll proceed to the cleansing. The nice thing about the Reviderm treatment is that you will analyze the skin, and according to the skin's condition, we will use the product which is appropriate to the skin. Now, as mentioned by Dr. Imad earlier, we have to use gentle products. So definitely we have the gentle cleansing milk. We also have the cleansing foam. We also have the other, I would say, cleansers available. Okay, but for the purpose of today's demonstration, okay, our client here is ready, so I'll start the treatment right now. For today's treatment, I chose the cleansing foam because it has got an ingredient particularly called honey, which is antibacterial. At the same time, you also have panthenol, which will help in calming down the skin irritation. So just apply. With the Reviderm treatment protocol, we don't have a specific signature hand movement. So according to your expertise and according to your experience, you can do the hand movement according to what suits you and what is the movement that you are used to doing for the cleansing. So again, you can use a gentle cleansing milk. You can also use, for me, I chose this personally because I would want to give the maximum benefit for her skin, especially that it's been a while that she's not doing any treatments on her face, and I wanted to have a proper cleansing. And of course, I would want to make her skin benefit out of the panthenol and the honey which is contained in our cleansing foam. Since she didn't wear any makeup, so a one face cleansing is fine. But if your client, if you can see that the client's skin is, I would say, having makeup, she's putting on foundation, of course, you have to do a double cleanse routine. So double cleanse routine means you have to cleanse the skin twice. So apply the product and then do the cleansing massage or the cleansing movement on the entire face. Also, if you wanted to do the neck area or the décolleté, you can do so. Okay. Now the skin of the client is properly cleansed. What I will do next, of course, you have to remove excess moisture. Then you will do to the enzyme exfoliation stage. What I like about Reviderm is that as compared to other brands or the other, I would say, products in the market, we don't make use of, I would say, the scrub, which is the typical scrub, which is based on granular or beads. What we have is an exfoliation which is based on enzymes. So we have three types, but the one that I'll be showing to you today is the enzyme peeling liquid. This is to soften the horny layers of the dead skin on the stratum corneum of the epidermis. So I apply it just like I normally apply a toner. Until all the product is absorbed. So the basic mechanism of action of this enzyme-based peeling liquid, basically amylase and bacillus, these are the main ingredients, is again to soften, to dissolve whatever topmost dead skin layer on the skin surface. So after it's done, what you have to do next is to apply the enzyme peeling paste. Now remember, I mentioned earlier that we have to anticipate the skin's the dead skin cells on the surface to be softened due to that enzyme peeling liquid. So what we'll be doing right now is to apply this paste, again based on enzyme. And the purpose of this paste, enzyme peeling paste, is to trap whatever dead skin cell debris or whatever dead skin cells that were dissolved at the surface of the skin. So this actually serves as a form of a mini mask. So you can leave it for 2 to 3 minutes. You just have to apply it very, very thinly. And this suits well, especially for sensitive skins, because we don't want the irritation to be more, or we don't want to trigger more inflammation. So with this kind of approach, it's a very mild way of exfoliating the skin without stripping the natural moisture of the skin and without causing any further irritation. You also don't need to apply so much because you only need to apply what is required by the skin. If you apply thinly or thickly, I mean in a thick or thin manner, it doesn't matter because what matters is when you apply the product, it traps the dead skin cells that were softened, brought about by the enzyme peeling liquid. Leave it for 2 to 3 minutes to dry. Then after it's dry, you have to use a pagazzling gauze or a rough gauze or a rough cotton, whatever you have, to remove the product from the skin as if erasing it from the skin. In that way also, it serves as an additional friction to the skin in order to make sure or ensure that the dead skin cells are removed. So it's like that. The best way for us to discern and to assess that the product is ready to be removed from the skin is to use the fingertip, tap, and you can see there's still a residue of the product over there, so it means it's still wet. So until such time when you again tap your finger on the skin, and if there's no more residue that is stuck to your fingertip, it means it's already dry and it's ready to be removed. As I mentioned earlier, the approach for treating the irritated or copperose skin is a less is more principle. In other words, we don't want to trigger all the more the inflammatory processes on the skin by doing so much on the skin. What you wanted to make sure is to prepare the skin in order that the succeeding ingredients, for example, our concentrates, our serums that will be put, will be absorbed by the skin so that it will cause the necessary expectation for the treatment. So for this treatment, for instance, I don't suggest and I don't recommend to do, I would say, intense microdermabrasion, of course, and it's not allowed. And of course, what I'm trying to say is the comedone extraction. Because again, if the skin is having this broken capillaries, it's red, then doing that squeezing of doing the comedone extraction will cause more irritation to the skin. So I will skip that part. So treating an irritated or copperose or rosacea skin is just to cleanse, prepare by mildly exfoliating using our enzymes. And then once it's ready, you then can put the active ingredient, which is our serum. Dr. Imad mentioned earlier, we have copperose serums 1 and 2. And just for us to be able to showcase in a very, I would say, short way, due to the time constraints, I'll just be using one serum, then apply a mask and leave it for 10 to 15 minutes. And then after that, remove the mask, put the ending or finishing cream, and then SPF. And that's the end of our treatment for today. Okay. But of course, if you want to have a more intense and thorough demonstration of this particular treatment, because aside from this mask, we have other options that we can use. We can use the collagen freeze instead of the cream-based hydro mask or the coming hydro mask, but that entails more time. So I'll be visiting you in your clinics to have a thorough demo of this particular steps. So let me check a little bit. It's still wet. And this is actually the thing, even though I have put in a very thin manner, it still takes time to dry. So all the more if you put the enzyme peeling mask in a thick layer, then it's all the more taking time to dry up. Okay. So I have here Teresa with me from Amwaj Polyclinic. Thank you so much for having us here and showcasing this treatment. While waiting for the time, do you see most of your clients, do you see cases of rosacea or copperose, Teresa?
Yes, we do have some clients like
Okay.
this case
Okay.
with rosacea and broken capillaries. But what we have on is laser,
Okay.
like vein removal.
I see. Okay. Thank you so much for mentioning that. Because of course we have other modalities to treat that. But again, for Reviderm, we have also this, I would say, treatment protocol. Because in this way, you can see more often the clients because they're gonna taking the packages.
And, and I think it will be a good option because if laser, if the patient is tan,
Mm-hmm.
you cannot perform laser. So
Yes.
it will be the best way to have another option.
Very good.
To it without, even if she is tan, right?
Thank you so much. That's a very good point there, especially that Europeans loves to do standing under the sun. And you can do intense treatment using the laser because again it's contraindicated. So having this as a treatment alternative or even as a main primary treatment protocol for rosacea or for cuperose is an added, I would say, tool in your arsenal of treatments. So if you will see here, it's already dry. There's no more residue left on the fingertips. So what I'm going to do is I'll have to use this pagazzling gauze, or we call it the rough gauze, to remove the product. So just put a little bit of like pressure as if you are erasing and removing the product together with the stuck dead skin cells. And as you can see, it doesn't seem to look that messy at all. It's even very satisfying. You can see, see the product residue is there with microscopic dead skin cells. And then you have to also do it the other side. This is actually particularly unique for this brand because I know that a lot of you guys are very much used to exfoliation with the use of a scrub, like a beads or a granular type of scrub, which is fine. But for rosacea skin, we don't want again to cause more irritation or inflammation by triggering, by causing, scraping of the skin. So this is the best treatment approach for them. Okay. So once that is done, what we have to do next is to remove the product from the skin. So I'll be using fresh how do you call this one? Yeah, it could be a cotton or non-woven gauze, yeah. And of course the fresh water. Because other places they use sponges, and I'm used to using sponges actually. Of course, the disposable ones. But this is also fine. Most clinics are using this. Non-woven gauze, yes. Okay.
Charmaine, not to disturb your flow, but as usual, for all our amazing attendees who wants to continue with us in the demo until the end, that's fine. But for those who has other clients waiting or other obligations, please feel free to leave because we are recording this presentation and we will be sharing it with you anyhow. Because it's 12:10 right now, and I understand that probably you will be having some other things to do. If not, you'll be more than welcome to stay with us until the end of the day.
Okay, Dr. Ivan, yes, definitely. So if you have time, you can continue joining us while I continue the rest of the treatment. So what I will be doing right now is I will tone the skin. I'll use the gentle pH balancer. It helps in balancing the pH of the skin. And as you can see, I skipped the comedone extraction. So what I will do instead is a very quick lymphatic drainage. Okay. So again, you have your own way of doing it in a very professional manner. You are trained to do this, especially for the esthetician. So whatever movements you are used to doing, please do so. Just a very quick one. Especially for environmentally sensitized skins, we wanted to make sure that the drainage would help in calming down the skin. Okay. And after that, I will put now the serum. One of the main ingredients also that I have checked with this copper serum, number one, is caffeine. So caffeine constricts the blood vessels, and that, of course, would reduce the inflammation for our client's skin. You can continue doing a little bit of lymphatic drainage movements as you apply the serum until it saturates the skin. As our serum is not, I would say, the consistency is not that watery, so you have to do a little bit of movement to blend in the product into the skin. So if you have clients who have or who are having rosacea, and at the same time they have issues of, I would say, comedones in the nose and the T-zone, I would suggest you ask the client first to do a deep cleansing, to do the proper extraction, then start in the next session after a few days or so, the copper rose treatment. Because again, we wanted to treat the skin, but of course the client also wants her skin to be cleansed properly. But again, in the interest of time and to make sure that we are not causing any, I would say, further irritation to the skin, better to do it in a separate session when the skin is okay or stable to do the extraction. Of course, you do only extractions on the areas where the skin barrier is fine, like in the T-zone or in the nose area. Okay. Now that the product is absorbed by the skin, I will then proceed to the application of our calming hydro mask. Again, one of the ingredients is panthenol, which is calming the skin. So this doesn't just calm the skin down, but it also hydrates the skin. And the way we are applying the mask, by the way, especially for our Reviderm mask, is you apply it very, very thinly, not a mask where you just leave it on the skin and wipe it off later, because this mask has got skin identical lipids, so it's absorbed by the skin very, very quickly. Like right now, you can see this cream on the skin colored white, but as we leave the product on the skin longer, this will diminish and it will be absorbed by the skin, which is good because you are putting products not just to boost the treatment underneath with the use of our active concentrates, but the mask on its own has got active concentrates which are benefiting the skin, which are penetrating deeply down the skin. So it's worth your money. You're not applying something to just remove it, but you're applying something to be added as a beneficial component into your treatment routine. Okay? So this is now the mask. Now I do understand some clients have the psychological feel that when the mask is thicker or it gives them that tightening effect, it's more effective. So to address that concern, we do have another mask. We call it the collagen fleece. And we also have another one which is part of the hydrolodge regimen, which is the plasterol. So basically, if this is going to be the full treatment, for example, using that hydrolodge, which is also beneficial for the skin, you put the collagen fleece, and then after that, you put the plasterol. And then it will be like a cement on the face. After 10 to 20 minutes or 15 minutes, it's ready to be removed when it's fully dry, and then the client can feel a more intense result in terms of the firming, the lifting, because it has that kind of chamber type of effect. Whatever products you have placed, it feels like it's tightening it, it's making it more taut and more, I would say, lifted because of the cement that you're applying on the skin. Okay. And then maybe we can do a demo for that in your clinic if you wish to know more about it. But again, for the purpose of our Reviderm Academy, I'm just doing I would say, the simple step procedure or protocol that you can start applying to your client's skin, okay, in your separate clinics. So we'll wait for 5 to 10 minutes, okay, in the interest of time. What I will be doing right now is I'll be doing a hand treatment to maximize our time here. So this is a guaranteed way to gain your client's confidence of you as a therapist, because you're not leaving the client during the mask stage. Okay, so you are doing an extra added service. And not only that, you are introducing a preparatory treatment prior to a hand filler. Some clinics nowadays are doing hand filler. So before injecting the fillers into the hand, we can do this as a preparatory approach. If you have back-to-back clients, then this is a luxury already to do. But if you have the time, this is one of the best ways for you to connect with your client and assure yourself that you have established a very good rapport with the client, and definitely the client will come back. Again, I would like to thank Amwaj Polyclinic for allowing us to be here. And they are using Reviderm products over here as well for information. Teresa, can I ask your help to get the water and give me some fresh water, please? Thank you. Okay. So I'll just cleanse it one time. And after that, I will put the ending or finishing cream to hydrate the skin. Thank you. If you have any questions, by the way, please don't hesitate to touch base to us. You can send us your questions or any concerns pertaining to this treatment, as well as to other treatments of the Reviderm protocol. Please send your messages while you are there in Zoom, or you can always touch base with us anytime. Okay. I'm using the Auto Hydro Fluid, of course, to hydrate her skin. In the hand area, of course. Okay, thank you. So now I want you to look at her skin. Okay, so it shows that the mask is, I would say, 90% absorbed. Yeah, so you don't need to apply in a thick way, because the thicker you put, then you're just wasting the product. You don't need so much. You just need to put a little bit just to hydrate that area of the face, because eventually the product will be absorbed by the skin. So right now, what I will do is I will remove the product from her skin But I just wanted to emulsify whatever masks which are still on the surface. And at the same time, I'm again using the lymphatic drainage movements, okay, to facilitate more microcirculation in the skin, and it will be beneficial for the skin, especially for those having issues with irritation or capillars. And in this way also, you are not just like removing the product, but you are also ensuring that the products are absorbed by the skin as you emulsify it. Okay, now, Teresa, can I ask your assistance? I need fresh water. Thank you. Thank you so much. Because the fresh water earlier, I used it to wipe her hands. So we wanted to make sure that we're not reusing the water and the gauze when once we cleanse this, especially that we are already approaching towards the end. Very nice. Okay. Then the finishing cream that we'll be using is the auto hydro fluid. If you'll notice, even in our moss, it has that hydro content, not just to calm the skin, but to hydrate the skin. Because once the skin is dehydrated, that would actually create gaps in between the skin cells because the skin is actually arranged just like a brick, you know. And if there is a gap missing, and that would be an avenue for transepidermal water loss or for elements in the surrounding area or the air that will go into your skin. So it's very, very important that your skin barrier is intact. Okay, so we do that by putting ingredients that not just to calm down the skin, but also to hydrate the skin, to fill in those gaps where a possible transepidermal loss will happen. Okay. It's also very important to establish a skincare goal as an expectation from the side of the client because when you analyze a skin's client, maybe she's got a load full of skin issues. But again, you can't address all the issues all at the same time. You have to base it on what is the skincare goal that your client expected you to have as a treatment approach on the skin. Then accordingly, you build up your treatment protocol as to how the skin responds to the treatment. That's the reason why I skipped the comedone extraction today, because I just wanted to emphasize on a less is more strategy for this kind of skin concern. And also, we wanted to emphasize the importance of lymphatic drainage in order to increase the microcirculation and at the same time treat the inflammation issues of the skin. Okay. Then the last but not the least is our SPF. So we're using Reviderm's SPF 20. It has a coverage for UVA and UVB. At the same time, it has an infrared protection. What is nice about this SPF is that it actually blends well to different skin tones, and it doesn't give you that white cast because some SPF are physical, I would say, SPF wherein we have this ingredient that gives you that very whitish cast on the skin. And if your skin is type 4, based on the Fitzpatrick scale, when you apply that kind of sunblock, it gives you that ghostly appearance, which you will not encounter when you use our Reviderm products. Then, as our ending treatment routine, Press this side. 1, 2, 3, release, press. 1, 2, 3, release. Do it 3 to 6 times according to your time allotment, whatever time allows you to do. And then lift the head, press the occiput, bearing the weight of the head. Because just imagine your client is lying down for an hour, so you wanted to give that extra relaxation boost by pressing on these pressure points. And then press the scapula, the shoulder blades, towards the bed. 1, 2, 3. Then press towards the end of the bed. 1, 2. And that's the end of our copper rose treatment. Thank you so much and see you next time. Thank you, Belle. Done.
Thank you so much, Charmaine. It was an amazing demo.